Welcome to the Nova Scotia College of Pharmacists, or NSCP, Pharmacy Technician Assessment Assessor Training. To start, the NSCP would like to thank you for your interest in becoming an NSPR-PTA Assessor and helping pharmacy technician candidates to complete the required practice-based assessment. The fact that you are here today means that you are a practice leader in our profession. The mandate of the NSCP, the pharmacy regulator in Nova Scotia, is to serve and protect the public. This includes licensing only those candidates that have demonstrated themselves to have the capacity to practice competently, safely, and ethically. Your responsibility as an appointed NSCP-PTA assessor will be to provide a comprehensive and objective assessment of a pharmacy technician candidate to assist the NSCP in making this determination. The NSCP cannot underscore enough the importance of this role. Before continuing with this presentation, let's first ensure that you and your site would meet established eligibility requirements for the NSCP-PTA. To be an NSCP-PTA assessor, applicants must meet the assessor criteria noted on the left-hand side of the slide and work in a pharmacy, referred to as the assessment site, that meets the assessment site criteria on the right side. For those who have been or are preceptors for pharmacy technicians or pharmacists, the criterion for an assessor is not unlike that for a preceptor, that is, licensed and practicing for at least 1 year with no conditions or limitations on practice, but there are a few additional conditions added. All assessors, including both pharmacy technicians and pharmacists, must be licensed with the NSCP, which, if you look to the right, aligns with the assessment site criteria that the pharmacy, also known as the assessment site, must be in Nova Scotia. All NSCP-PTA assessments must be conducted in Nova Scotia. There are some enhanced requirements around professional accountability. An assessor can't have any open cases undergoing a professional accountability process in Nova Scotia or other jurisdiction, or have any findings of professional misconduct, conduct unbecoming, professional incompetence, or incapacity made against them in Nova Scotia or other jurisdiction. All assessors are required to complete assessor training. That is this online training that you are taking right now. On the application, assessors must declare that they will not act as an assessor for a candidate with whom they have previously worked or with whom there exists any real or perceived conflict of interest. They must also ensure that they have no bias, either favorable or unfavorable, towards the candidate. In this training, we will be taking a closer look into conflict of interest and bias. With respect to the assessor's workplace, aka the assessment site, it is imperative that it is a site favorable to an assessment, namely, it has sufficient staffing and resources that allow for the assessor to fulfill their role, and there is physically enough space that allows for the assessor to interact and closely observe the candidate. And critical to the assessment is that the candidate will be able to engage in a full range of scope of practice activities and have the opportunity to demonstrate their competence for all key competencies targeted in the assessment. So, assuming you and your site meet these criteria, once you have completed this training and remain interested in becoming an assessor, you will need to submit an NSCP-PTA assessor application. It is an online application and can be accessed from the NSCP website. NSCP staff will review the application and notify the applicant if they are eligible and have been appointed to be an assessor. The NSCP-PTA Assessor Guide, also accessible on the NSCP website, contains information helpful for assessors. In terms of setting out an agenda for this training, we will be taking a look at the NSCP-PTA program as a whole and then drilling down to specifics as they relate to the assessor role and the use of the assessment tool. This training program is accredited by DAL CPE for 1 CEU. A certificate of completion can be accessed by completing a short quiz using the link provided in the description section below. You will be asked to provide your name at the beginning of the quiz, as this provides confirmation to the NSCP that you have completed the training program. But not to worry, the NSPR will not be reviewing any of your responses to the quiz questions. Goals of the training are to ensure that all assessors understand the NSPR-PTA process, their role as an assessor, and that they feel competent using the NSPR-PTA assessment tool in a consistent way. There is lots of information available on the NSPR website for pharmacy technician candidates to help them understand the process and expectations and how to prepare themselves for the assessment before they come to you for their assessment. And for assessors to also understand the process and their role and responsibilities as an NSPR-PTA assessor. The information on the NSPR website can be found by looking under Registration and Licensing on the home page, followed by Pharmacy Technician, Graduate Not Previously Licensed, Graduate of an Approved Pharmacy Technician Bridging Program, and finally Step 2, Pharmacy Technician Assessment. Or if that is just too long of a search path to remember, simply search Bridging Program on the home page and that should point you in the right direction. Information on the website includes links to online application forms and candidate self-evaluation of readiness for the NSPR-PTA, candidate guide and an assessor guide, an orientation checklist, a bias and conflict of interest document, and finally, the NSPR-PTA assessment tool itself. While the final assessment of the candidate will be submitted by the assessor using an online submission form, a PDF of the assessment tool showing the competencies being assessed, the associated criteria, and rating scales is provided as a resource for assessors and candidates to be able to refer to. If you have not already reviewed the information available on the NSPR-PTA, I would suggest that you pause the video and take some time to familiarize yourself before continuing with the training. Taking a look at who must complete the NSPR-PTA, a practical assessment is required of all individuals wishing to be licensed as a pharmacy technician under the Registration, Licensing, and Professional Accountability Regulations. Currently, the following pharmacy technician candidates must complete this assessment: those who have completed an approved bridging program and who are applying for licensure in Nova Scotia as a pharmacy technician for the first time, those who have been trained and hold a license registration outside of Canada and who are applying for licensure in Nova Scotia as a pharmacy technician in Canada for the first time. Pharmacy technician candidates completing a CCAP accredited educational program currently meet this assessment requirement through completion of their structured practical experience program. But with anticipated changes to legislation, the intention is that all pharmacy technician candidates will be required to complete the NSPR-PTA in the future. The length of the assessment is a minimum of 35 hours completed over a 1-week period. It may be necessary to extend this time in order to accommodate working schedules or to allow for sufficient time for the candidate to adequately demonstrate competence in all key competency areas. Therefore, the assessment period can be extended to a maximum of 70 hours completed over a 2-week period. Note that time spent for orientation to the assessment site is separate and apart from assessment time. Let's take some time to address questions that you may have now or will very likely have at some point. First question, can I assess more than one candidate at a time? The answer is no. Given the commitments on the assessor to personally supervise and observe the candidate at all times, an assessor's attention can't be divided between candidates. Additionally, having 2 or more candidates in the pharmacy at the same time could compromise the assessment. Can more than one assessor share the responsibility of assessing a candidate? The answer to that is yes. 2 assessors working at the same assessment site are permitted to share assessor responsibilities. Both assessors are required to submit their own assessor application and be approved by the NSPR. The names of both assessors must be provided when the candidate applies for the assessment. No more than 2 assessors can share assessor responsibilities. Working collaboratively, co-assessors will ensure that all requirements of the program are met, including that the candidate is observed and always supervised by an assessor, and that all competencies are assessed. Co-assessors will jointly determine the final assessment ratings for each key competency. Software limitations prevent more than one assessor accessing the online submission form and inputting the final assessment results. But the name of the two co-assessors will be recorded on the submission, and it will be considered a mutually agreed upon assessment. What do I do if my workplace changes from what I had recorded on my application? You are approved as an assessor at the site listed in your application. So you are to inform the NSPR if your workplace changes. What if the candidate or you want to take time off during the assessment period? No pre-planned time off is allowed, so do not agree to taking a candidate if you have pre-planned time off during the assessment period. If an emergency arises that necessitates time off, reach out to the NSPR for guidance as soon as possible. Do I get paid to be an assessor? Assessors will receive a $300 honorarium for each candidate they assess. If co-assessors share the assessment responsibilities, the honorarium will be split equally between the two. Assessors are required to submit a completed request for honorarium form to the NSPR once the candidate's final assessment has been submitted to the NSPR. There will be a place on the form to indicate if you are a co-assessor. And finally, why am I required to take training to be an assessor? No requirement was required to be a preceptor. Being an assessor is different from being a preceptor, and the NSPR-PTA is a high-stakes assessment. As mentioned earlier in the presentation, it is of the utmost importance that assessors understand the NSPR-PTA process, what their role and responsibilities are as an assessor, and that they are competent in using the NSPR-PTA assessment tool in an objective, unbiased, and consistent way. Many of you have likely served as preceptors for candidates completing their structured practical training. The preceptor role is notably different from an assessor role. So how so? This table summarizes some of the differences. As a preceptor, you take on a supportive role, including teaching, coaching, mentoring, but as an assessor, your role lands squarely on that of an evaluator or judge. Whereas a preceptor's goal is to help a candidate develop their skills using interactive and instructional means and providing lots of guidance, an assessor's focus is on verifying a candidate's competence as demonstrated through independent practice. The role of the preceptor includes providing feedback on how well a candidate completed an activity or handled a particular situation and making suggestions for improvements for the future. Assessors, on the other hand, directly observe candidates as they independently engage in practice and do not provide feedback or advice. This ensures that candidates do not receive any indication of the assessment outcome and that their performance is not influenced. The NSPR-PTA is similar in approach to the PEBC practical exams, that being the OSPE for technicians or the OSCE for pharmacists. No feedback is provided, and candidates leave an exam scenario not knowing how they performed. Instead, guidance is provided to the candidate in the form of prompting questions and probing questions that are used to help understand their thought process. The NSPR-PTA assists the NSPR in making its determination of whether an applicant has the capacity to competently and ethically practice and therefore can be licensed. The assessment of capacity and competence carries with it a different weight than that of structured practice experience. It is important to spend a little time talking about bias and conflict of interest. Impartiality is essential to fair assessment in the NSPR-PTA, and two factors that can affect impartiality are bias and conflict of interest. So it's important to understand what is meant by bias or conflict of interest and how these can be mitigated. The NSPR has created a document to help in this regard, and I would encourage you to review it if you have not already done so. The document includes questions to ask yourself to help you identify whether a bias or conflict of interest might exist. It can be accessed on the NSPR website and in the description section below. So let's start with first defining the two terms. Bias. Bias is a predisposition, either favorable or unfavorable, that can influence judgment. It involves preconceived notions or beliefs that may lead an assessor to evaluate a candidate unfairly. These biases, whether conscious or unconscious, can undermine the objectivity of the assessment process. Examples of bias could be preconceptions about the candidate, including both their background and training, prior knowledge of the candidate, generalization of past experience with someone with a similar background, familiarity with the assessment site, either as a patient, volunteer, or employee. One can see the bias and conflict of interest potential associated with a candidate completing their assessment at a pharmacy where they currently work or have previously worked or volunteered. The NSPR has followed current best practice to disallow this, an approach consistent with other regulators and educators. Conflict of interest. A conflict of interest is a situation in which an assessor has a personal or financial interest that could reasonably be seen as affecting their ability to make an impartial decision. It involves a clash between the assessor's professional responsibilities and their personal interests, which could compromise their objectivity. A conflict of interest does not necessarily imply wrongdoing, but it creates the potential for biased judgment. Examples of conflict of interest could include familial or personal relationship between the assessor and the candidate, a financial relationship. Say candidate has a business connection with either the assessor, manager, or owner of the assessment site. Both candidates and assessors are required to make declarations on their application forms with respect to avoidance of conflict of interest. Candidates declare they have no conflict of interest with the assessor or the assessment site. Assessors declare upfront that they will not be an assessor for a candidate where a conflict of interest may exist. If a conflict of interest surfaces or concerns around bias arise later on, say after the assessment has started, the assessor and/or candidate must inform the NSPR right away so the matter can be considered and dealt with accordingly. There can be significant consequences associated with a bias or conflict of interest that was not disclosed to the NSPR, including leading to a decision requiring the candidate to redo the NSPR-PTA with a different assessor at a different site and at additional cost, and possibly a withdrawal of the assessor's appointment as an NSPR-PTA assessor with the NSPR. This is a visual depiction of the NSPR-PTA model or process. Let's start with the candidate and their preparation. The importance of the pharmacy technician candidate reviewing all information about the NSPR-PTA in order to fully understand what will be required in meeting this licensing requirement and the competencies that will be assessed on when they undergo the assessment has been communicated to candidates. Candidates are also encouraged to complete the NSPR-PTA applicant self-evaluation of readiness tool to assist them in gauging their readiness for the assessment. It is important that candidates only attempt the NSPR-PTA when they feel they are well prepared for the assessment. Working or volunteering as a pharmacy assistant does not allow a candidate to practice in the scope of a pharmacy technician and will not provide sufficient practice opportunities to fully prepare for the NSPR-PTA. Gaining adequate experience working within the scope of practice of a pharmacy technician is essential. With that said, pharmacy managers, owners, employers, and other pharmacy practitioners working with a pharmacy technician candidate are encouraged to provide such opportunities for the candidate. Jumping over to the assessor side of the diagram for a moment, in parallel, potential assessors like yourself are doing their own preparation, reading up about the NSPR-PTA and being an assessor and doing this training. And then, fingers crossed, following up with submitting an application to the NSPR. Back over to the candidate. So once the candidates decided they are ready to proceed with doing the assessment, they then must secure an assessor and an assessment site. As mentioned, candidates must complete the NSPR-PTA somewhere besides their own place of work. It is the candidate's responsibility to secure an assessor and a site. The NSPR does not match candidates to assessors. The NSPR will keep an updated list of assessment sites posted on their website. If a candidate wishes to complete the assessment at an assessment site and with an assessor that has yet to be approved by the NSPR, The assessor must complete the required training and apply to be an NSPR-PTA assessor. Once the application has been approved, the candidate can commence the assessment. Employers of pharmacy technician candidates are encouraged to assist their employees in securing an assessment site. The NSPR advises that the candidate is to complete the assessment in a similar practice setting to where they have previously experienced, whether hospital, community, a pharmacy with a similar workflow, and or similar pharmacy software. Candidates are also permitted to complete the NSPR-PTA at a pharmacy that is part of their employer's organization, provided they have not trained, worked, or volunteered at that site on a regular basis. And they have no prior relationship with the NSPR-PTA assessor, of course. For example, a candidate's assessment site could be part of the same hospital network or the same pharmacy chain or banner of their current workplace. Next steps. The candidate submits an application, which includes the name of the NSPR-approved assessor and site where they plan to do the assessment. The candidate and assessor then work together to determine the start date and scheduling for the assessment and any pre-assessment orientation time that may be required. The next phase of the process include an orientation to the assessment site, followed by the assessment itself. And there's more to come on both of these. At the end of the assessment, the assessor will submit their final assessment of the candidate by an online assessment form. This signifies the end to the assessor-candidate relationship. The submitted assessment is reviewed by the NSPR, and there are two possible outcome decisions to come from the results of the assessment: either competence demonstrated or development required. If a candidate is successful in their NSPR-PTA assessment, then this registration requirement is deemed to have been met. If the candidate is not successful in demonstrating competence, further development of competence will be required, and the candidate will not be able to reapply for the NSPR-PTA for a minimum of 4 weeks. The candidate will be provided with a performance profile that identifies the relative strengths and gaps in their performance in relation to the competencies being assessed. The candidate is encouraged to review the performance profile and prepare a learning action plan. They're also encouraged to engage a coach or coaches, that is someone or someones, who are able and willing to help guide the candidate's self-directed, individualized training and help them prepare for their next NSPR-PTA attempt. The practice site should provide enough opportunities for the candidate to fulfill their goals as set out in their learning action plan. The duration of the development period will depend on the number of areas identified through the NSPR-PTA assessment as requiring development and the amount of time it will take to address them. But as mentioned, it must be a minimum of 4 weeks. When the candidate believes they are ready to reattempt the NSPR-PTA, they can submit another candidate application form, choosing a different assessment site and assessor, and paying another assessment fee. The goal of the orientation phase is to provide the opportunity for the candidate to orient to your practice site so that they are sufficiently familiar with your workplace to engage in practice as a pharmacy technician candidate when undergoing their assessment. This orientation time allows for the assessor and pharmacy staff to teach the candidate the basics. For example, how the workflow is set up, how to use software, pharmacy-specific processes and procedures. The amount of time required for orientation to the assessment site may vary among candidates and will be influenced by the candidate's prior practice experiences. A word about bias here. When you first meet your candidate and during the orientation, it is important to circumvent opportunities for potential biases to creep in. For instance, you would want to refrain from doing something like, say, asking for a resume or a summary of where the candidate has worked, for how long, etc. If you consider why you would want to know such things, it could be to sum up the candidate, so to speak, and determine whether the candidate brings background and experiences suitable to your own personal tastes and opinions. That in itself is bias. As your time together progresses, naturally in conversation you may learn things about a candidate, but it's important to keep this from having any influence on your assessment of the candidate. There's an orientation checklist that can be accessed on the website and is also linked in the description section below that you may find helpful to use. The list may not be all-inclusive, and there may be additional topics that you, your manager, or your employer may wish you to address. In addition to the items on the checklist, during orientation provides a good opportunity for you to let the candidate know things like that you may provide guidance, ask prompting questions, or need to step in when they are doing something, but this doesn't necessarily mean that they have done something wrong. That you can't provide feedback, that you need to supervise them directly. So that includes things like phone calls, patient interactions, and that you need to review their work, including prescriptions checked by the candidate, packaged medications, and so forth. It is important that pharmacy staff are oriented to the process and what to expect as well. What does that look like? Things on the checklist would include clarifying the roles of the candidate and you, the assessor, explaining that the NSPR-PTA is a high-stakes assessment to determine if the pharmacy technician candidate is ready to safely practice as a pharmacy technician, and staff are not able to teach the candidate, provide feedback, or otherwise be involved in the assessment. And also checking if any staff members have a prior relationship with a pharmacy technician candidate and reflect on whether this could potentially affect or bias your assessment. Some additional notes about orientation before we move on. First, the assessor does not have to do all orientation activities themselves. Parts can be delegated to other pharmacy staff. There is to be no training by anyone to be provided to the candidate on how to practice as a pharmacy technician, not during this orientation phase or the assessment phase. Keep in mind that the purpose of this assessment the candidate's about to undertake is to assess the level of knowledge and skills that they are supposed to already have as a result of their education, training, and past work experiences, and evaluating how they independently apply this to practice as a pharmacy technician. The candidate cannot engage in practice as a pharmacy technician candidate, but may assist with the dispensing drug distribution process, so assistant activities, to ensure that they are prepared to engage in practice at the site during their assessment. At the end of the orientation, the candidate confirms to the assessor that they are ready to move forward with the assessment. This reconfirmation, with this declaration first being provided on the candidate's application, provides the opportunity for the candidate to reflect on whether they are ready to proceed. The length of the orientation will vary depending on the needs of the candidate, but whatever the amount of hours it turns out to be, they cannot be counted towards meeting required assessment time hours. The goal of the NSPR-PTA, or the question that we're looking to answer, is, does the candidate have the knowledge, skills, and ability to practice safely, competently, and ethically within their legislated scope of practice at an entry to practice level? So let's break that down. Having the knowledge and skills addresses the candidate's training and preparation, which is the responsibility of the educational institution. Ensuring a candidate is able to practice safely, competently, and ethically speaks to the role of the regulator in licensing individuals. This is a requirement embedded in legislation. Practicing within their legislated scope of practice, while there are substantial similarities in scope of practice of pharmacy technicians across the country, there exist some differences. The scope of practice for pharmacy technicians in Nova Scotia is broad, seeing expansion over recent years. Performing at an entry to practice level. This references the NAPRA, or National Association of Pharmacy Regulatory Authorities, entry to practice competencies. The NSPR-PTA assessment is looking for a performance level expected from a new practitioner at an entry to practice level, and not the performance one would expect from an experienced practitioner. It is the responsibility of the NSPR to serve and protect the public, which includes licensing only those candidates that have demonstrated themselves to have the capacity to practice competently, safely, and ethically. The assessor's role in the NSPR-PTA is critical. Providing the NSPR with a comprehensive and objective assessment of a candidate's performance assists the NSPR in making this determination. This is a general list of the activities that fall within the technical focus scope of practice of a pharmacy technician in Nova Scotia. As you can see, it is quite extensive and ranges from distribution-related tasks to more clinical care-focused activities. While the expectation is that the pharmacy technician candidate will engage in the full range of distribution-related tasks during the assessment, it is understood that the opportunity for other activities, for example, giving injections or doing point-of-care testing, may not present itself during the time in the assessment. So hopefully now you have a better understanding of the NSPR-PTA program, its purpose, and the process. Let's now turn our attention to the assessment itself and the use of the assessment tool. On this slide, you will see some general overarching principles related to the assessment and your role. First off, allow the candidate to take the lead. Allow them to naturally engage with respect to providing care and related workload, prioritization of tasks, collaborating with pharmacy team members, physicians, and other healthcare providers, all in accordance with the regulations, standards of practice, and code of ethics. You must observe the candidate closely the entire time. You cannot delegate this to anyone else except for a co-assessor, as mentioned earlier in the presentation. Do not offer coaching, training, or feedback. You are not to share any assessment ratings with the candidate. Check all candidates' work for accuracy and completeness. It is important, again, that staff are made aware of the purpose of the assessment, that they cannot be involved or interfere in any way. So that means they cannot offer coaching, guidance, or support in completing the practice activities that they are being assessed on. This does not preclude offering guidance on things related to workflow processes, for example, use of the computer or other equipment, or on policy-related rules. You must observe the candidate's practice and how they make decisions and do the things they do. Pharmacy practice is not black and white, as we all know. Sometimes the candidate may make a decision or approach a situation in a manner that might differ from what you would have done, but that doesn't necessarily make it wrong, just different. So when they are making decisions during the assessment, you may choose to step in, as it may not be the policy or process at this practice site, but the candidate should not be penalized for making a different customer service-related decision, as long as patient care is not compromised. It is perfectly fine to probe and ask about why they may have made a particular decision so that they have an opportunity to justify it. For those of you who have been around for a while, you may remember the old version of the NSPR-PTA that was used for bridging program candidates between 2013 and 2019. With the enabling of a bridging program pathway again, the NSPR recognized that the old pharmacy technician assessment required significant updating to align with current practice expectations and best practices in competency assessment. Like the old version, the current PTA is based on the NAPRA entry to practice competencies, but it is really there that the similarities end. The NSPR-PTA targets 14 competencies out of a possible 23 in the 2024 version of the entry to practice competency document. Note, all key competencies, that is the 14 that are in the assessment, must be assessed. There is no option for a not applicable or a not observed rating. Recall that I mentioned earlier that in your application to become an assessor, you must declare that the pharmacy where you work, that is the assessment site, provides the opportunity for a candidate to demonstrate all of the relevant or targeted key entry to practice competencies. Of note, not all enabling competencies that are associated with a key competency must be demonstrated during the assessment. When we take a closer look at the document in a slide coming up, we will see what is meant by a key competency and an enabling competency. As already mentioned, the NSPR-PTA is based on performance of a candidate at an entry to practice level as defined in the entry to practice competency document. Any specialized knowledge or skill above those of all pharmacy technicians, that is, at an entry to practice level, are not required to be demonstrated over the course of the assessment. As an example, while the 2024 entry to practice competency document now includes administration of injections as an entry to practice competency, and this activity is included in a pharmacy technician's scope of practice in Nova Scotia, training for this has yet to be incorporated broadly across all training programs in Nova Scotia, so not all candidates will be trained or competent to give injections. The NSPR-PTA assessment tool includes administering injections as an enabling competency, and demonstration of this could be considered should the candidate be trained and have a valid drug administration by injection technical permit, and the opportunity presents itself while they are on site. I would caution you, though, do not schedule a candidate to give injections for a significant block of time, I'm thinking during the busy flu season, as they have many competencies to demonstrate in a relatively short period of time. You are encouraged to engage in conversations with your candidate during their orientation to set expectations for their upcoming assessment. In all circumstances, assessors must have the required knowledge, skills, and training to perform the act themselves, take injection administration for example, before being able to supervise and assess a candidate who performs it. The 14 key competencies taken from the 2024 NAPRA Entry to Practice Competency Document will fall under one of these 4 domains seen on the slide: providing care, clinical care, providing care, distribution, communication and collaboration, or professionalism. There are 2 domains in the Entry to Practice Competency Document that are not represented in the NSPR-PTA, those being knowledge and expertise and leadership and stewardship. These competencies would be evaluated in other assessments, such as the PEBC exams. You will find a link to the NSPR-PTA assessment tool in the description below, and it can also be accessed from the NSPR website. The layout in the document will look a bit different than how the information is presented on the slide, but the content is identical. So let's do a bit of a walkthrough of the sections. At the top is the overarching domain. Shown here is the first domain, providing care, clinical care. Underneath this and highlighted, you will see a key competency associated with that domain. I referenced key competencies a couple of slides back, as you will recall. Key competencies represent broadly defined competencies required of all pharmacy professionals. The assessment relates back to this key competency. Moving down, you will see a list of enabling competencies that fall under the key competency. These denote more defined expectations, either of all pharmacy professionals or are specific to the role of a pharmacy technician. The technician-specific enabling competencies are easily identified by the letter A after the competency number. You will find a number of these throughout the document. Not all enabling competencies need to be demonstrated, although the more that are, the easier it will be to provide a holistic assessment of the candidate's competency as it relates to the overarching key competency. And finally, we have the behavioral indicators. Each competency includes a list of behavioral indicators. These represent examples of observable activities or actions that relate to the key competency and are intended to assist the assessor in evaluating the candidate. It is important to note that not all behavioral indicators will need to be observed, and they may differ depending on the practice site, for example, community long-term care versus hospital. Assessors may use their judgment to identify other activities at their practice site that would also demonstrate competence. For those of you who have precepted candidates during structured practice experiences, you will note the absence of a specific list of tasks for the candidate to complete and for you to check off. There are no set lists of activities, but rather the behavioral indicators guide the assessment. On this slide is depicted what I would refer to as the common rating scale, and it is the rating scale to be used for 13 of the 14 key competencies in the PTA. It is a 4-point rating scale and has been structured similarly to the evaluation criteria set out in the NSCC and Eastern College Practicum Manuals and in the Eastern College Postgraduate SPE Program Manual. The NSPR-PTA rating scale criteria take into consideration an assessment of the candidate's knowledge, skills, and abilities, or KSAs, to perform activities and knowing how to apply them, and the level of guidance required by the candidate to properly and thoroughly complete activities. You can find many definitions of knowledge, skills, and abilities, but essentially, knowledge is the understanding and awareness of facts, information, and concepts acquired through experience or education. Skills are the learned capacity to perform tasks or activities with proficiency, often developed through training or practice. Abilities are the innate or developed qualities that enable a person to perform tasks or actions effectively. Looking at the continuum of KSAs in the rating scale, they range from lacking the KSAs required to complete activities, which is aligned with an unsatisfactory rating, having the KSAs but not able to consistently or independently apply them, that's a needs improvement rating, having the KSAs and is able to complete activities independently and with confidence, which is either a satisfactory or exemplary rating, the difference between these two ratings being in the level of guidance that may be required. So looking at level of guidance for a candidate to complete activities, the changes into the descriptors are subtle but different. They range from extensive guidance required, or in other words, always or just about always requiring guidance. This equates to an unsatisfactory performance rating. Frequent guidance is best represented by a needs improvement rating. Minimal or occasional guidance aligns with a satisfactory rating, and rare guidance, or almost never, would be demonstrative of an exemplary performance. I will talk more about guidance later in the presentation. In order to get a sense of a candidate's true abilities, the assessor needs to see them engage in an activity more than once, with the final assessment for each competency taking into consideration the candidate's practice and performance through the entire assessment period. Take time to become familiar with the descriptors for each of the 4 ratings. Note there are no half ratings. A rating of 1, 2, 3, or 4 must be chosen. If a candidate's behavior falls somewhere between 2 ratings, the lower rating must be applied. A note about level 4, exemplary. Performance at this level would generally not be seen nor be expected for a practitioner just entering practice. For those candidates who may go above and beyond the entry-level requirements, this rating could be considered. As for all ratings, please ensure you provide supportive reasoning in the comment field. And finally, we have the comments section. Comments on observations must be provided for all competency ratings. You should include comments about your candidate's strengths and areas for improvement, reflecting back on the key competency. The rating assigned needs to align with the comments provided. For example, it would be incongruent to have a score of satisfactory, yet the comments indicate concerns about a candidate's ability to complete tasks and/or requiring lots of guidance. As mentioned, the common rating scale that we just reviewed is used for all but one of the key competencies being assessed. That is competency 3.1, use effective communication skills. This competency is set up in the same way as the others. This domain, a key competency, enabling competencies, and behavioral indicators. It is the rating scale that has been set up quite differently. Before we look at that rating scale, let's take a moment to read through the behavioral indicators on this slide so that when we take a look at the rating scale, you will be able to see the connection between the two. So the behavioral indicators include communicates effectively with attention to tone, speed, and audience, demonstrates a caring attitude in conversations with or about patients, so is compassionate, empathetic, respectful of diversity, supportive, uses nonverbal skills appropriately, such as eye contact, posture, hand gestures, and personal space, adapts communication to specific contexts and situations, and writing is clear, organized, and concise. So yes, this looks very different. You can see that the rating scale criteria for this competency directly reference the behavioral indicators. They describe increasing competence in verbal and nonverbal skills, attitude, communication adaptation, and writing skills. At the unsatisfactory end, you would observe such things as unclear or inappropriate verbal communication, absence of a caring attitude, ineffective or inappropriate nonverbal skills, inability to appropriately adapt communication, and struggles with written communication. At the exemplary end, the candidate will demonstrate excellent verbal and nonverbal communication skills, a caring attitude, ability to easily adapt communication to various contexts and situations, and a well-honed written communication skills. Needs improvement and satisfactory ratings lie somewhere between these two ends. The rating scales have been set up in this manner to assist the assessor in objectively evaluating this rather nuanced competency. Pharmacy technicians serve as a key point of contact between patients, pharmacy team members, and other healthcare providers, and the ability to successfully communicate underpins virtually all practice activities, so having strong communication skills is essential in delivering safe and effective pharmacy care. An assessment of communication skills needs to consider not just what was seen or heard, but also the effectiveness and the impact of the communication in different contexts. As for the case for the final assessment ratings applied for all the other competencies, consideration is to be given to the candidate's performance throughout the entire assessment period. When observing a candidate, you can see what is being done, you can hear what is being said, but it may be hard to tell what a candidate is thinking, so you may need to ask some probing questions in order to assess their thought processes. This allows you to gauge a candidate's thinking and how a candidate comes to a decision, their technical and ethical decision-making processes, and it gives you some insight into their management of situations. Some examples of probing questions would be, what factors are you considering in reviewing this prescription? Why do you think that happened? Can you explain what you meant by that? It's a good idea to let a candidate know before the assessment starts that they should anticipate that you will be asking these types of probing questions, not because you are questioning the suitability of their judgment, but because you are trying to understand their thinking behind their actions or decisions. I've talked about guidance and how that factors into assessing a candidate and applying an appropriate rating score. So what is meant by providing guidance? What does that look or sound like? Guidance refers to the strategic use of prompting questions to help an individual reflect, explore options, and arrive at their own understanding or solution. Prompting questions can be used to stimulate a response or initiate a desired action. Some examples of prompting questions are, when do you need to alert someone, and when might you be able to handle a request from a nurse independently? What would you consider when deciding whether to involve the pharmacist in a patient interaction? Would you do anything differently if the situation were to happen again? Can you explain the importance of ensuring the patient understands how to use their medication correctly? How might you prioritize your tasks while ensuring thorough and accurate information is provided to a patient or provided to a nurse? Is there anything else you should be considering in preparing this medication? When the candidate provides the response, you will not provide feedback on that or advice, but simply make note of it for your reference, to track progress, and for when you complete the final assessment. You might find that after one prompt, another is needed. If after multiple prompts the candidate is not arriving at an action or the action is inappropriate, you can say something like, okay, thank you, I'll take it from here, and ask the candidate to work on something else. The amount of prompting and or lack of appropriate response are factors to consider, though, in your final assessment. The amount of guidance required for a candidate to complete activities is one of the critical indicators of performance that is utilized throughout the assessment tool and part of the evaluation criteria used in determining an appropriate rating for each competency. When assessing the level of guidance for a particular competency, you should consider the following three factors. 1. Does the candidate take initiative? Do they readily engage in their scope of practice, or do they require prompting from you? 2. Does the candidate require direction from you to complete tasks? Do they appear to have a logical thought process and are able to use professional judgment appropriately, or are they uncertain about how to make decisions within their own scope of practice? 3. Does the candidate require assistance from you to complete tasks? Do they have the knowledge, skills, and abilities to complete the activities, engage in scope of practice, or do they need help filling in the gaps? To assist the assessor when completing the NSPR-PTA, the distinction between guidance levels is shown in this diagram. In the second row of this table, you can see that the level of guidance ranges from critical to never or rare. Below this, you will find descriptors that take into consideration the level of risk, knowledge, skills, and abilities, initiative taken, professional judgment, intervention required, and effectiveness at completing tasks. So a whole lot in there to help in the consideration of where a candidate's performance may sit. At the top of the table is the corresponding rating used in the NSPR-PTA. Let's give the table a try. On the next slide, you will hear a short audio case presentation prepared by and board with permission from the Ontario College of Pharmacists. You will note a reference to intern technician in the audio clip, which would be the NSCP's equivalent of a pharmacy technician candidate. I would like you to first listen to the case presentation. While doing this, consider the interactions between the assessor and the candidate Miriam as she responds to a request for a stat medication in the hospital. I would like you to consider the amount of guidance the assessor provides to Miriam. Once the presentation advances to the next slide with the guidance table on it, pause the recording and give yourself a moment to reflect on the case. Based on the details of the case and looking at the guidance ratings in the table, how would you rate the level of guidance Miriam requires? What NSPR-PTA rating would you apply to Miriam's performance? Once you have your answers, resume the presentation.
Intern technician Miriam receives a stat message from the East Wing Emergency Department at 10:20 a.m. through your computer system. The message reports that a patient has been admitted for severe anaphylaxis, and currently there is not enough epinephrine available to prepare the necessary syringes for this patient over the next hour. Miriam reads the message and asks you about the delivery for the East Wing Emergency Department. You inform her that the medication delivery is scheduled for 12 noon, as was explained during the orientation phase and is posted on the wall for reference. Miriam begins drafting a response to the nurse that reads, "Hello, the restock delivery for your unit will be at 12 p.m. This is when the stock is delivered." You review the message before it is sent and ask if there's anything else that she should do before the delivery time, considering the urgency of the situation. Miriam is uncertain, prompting you to ask if she would like to send any medication before the scheduled delivery. Miriam replies that she will send some to the ward, but she isn't sure how many. You respond by asking her how she could find out how many vials to send. Miriam is stumped. You prompt her to review the MAR to determine the rate of medication administration. After reviewing the MAR, Miriam calculates the number of vials to send, but you notice she made an error based on the vial size. You step in to calculate the correct amount and prepare the epinephrine vials. Miriam then checks the supply but overlooks verifying the expiry date and documenting the lot number. You remind her to complete these steps and recheck her work. After bagging the medication, she proceeds to the tube station to supply the nursing floor, but mistakenly punches in the West Wing instead of the East Wing for the pneumatic tube station. You intervene, asking her to confirm if she selected the correct ward. Miriam notices the error and corrects the destination. She believes she's finished all necessary tasks, but has forgotten to respond back to the nursing message on the computer system. You guide Miriam to inform the nurse that the medication will be available in the tube for retrieval. You then suggest Miriam to let the cart delivery staff know about the increased medication use and remind her to charge the nursing ward for this medication.
Here again is the slide showing the scale of ratings for levels of guidance. If we look at the second row with guidance levels ranging from critical to never or rare, what rating should be assigned to Miriam? If you've not already done so, please pause the slide to give yourself some time to reflect on the details of the case and what rating based on level of guidance you think Miriam should get. I think it would be fair to say that if you look at the descriptors below, You could rule out the far end ratings of critical and never or rare, as they just do not fit to the situation. This would leave you with significant, some or frequent, and minimal occasional as possible choices. Let's take a look at minimal occasional rating and the descriptors beneath. Takes initiative readily, usually demonstrates appropriate judgment, minimal intervention required, completing tasks effectively. I think most would agree that that would not be a suitable rating. Now we are down to two possible ratings, some or frequent or significant. If we look at some or frequent, let's take a look at the first descriptor. Intermittently displays initiative. I think that evidence was lacking for that, as was for demonstrating appropriate professional judgment. I think you would probably agree that a lot of intervention was required, but was it frequent, which would support a rating of some or frequent guidance, or extensive, supporting a rating of significant guidance? Given how many times the assessor had to prompt or remind Miriam, a rating of significant would be the most appropriate. Translating that to the NSPR-PTA rating scale, that would be a corresponding 1 unsatisfactory. Hopefully, working through this case has been helpful to show how to approach rating a candidate's performance during their assessment. On the next slide, you will hear another audio case, this time set in a community pharmacy where Mrs. Alva has come to pick up some medication and the candidate Jordan is involved in that interaction. As before, pay attention to the interactions between the assessor and the candidate and consider the amount of guidance provided by the assessor to Jordan. When the presentation advances to the next slide with the guidance table on it, pause the recording and on your own, determine what level of guidance you believe Jordan required and subsequently what assessment rating you would give Jordan.
Mrs. Alva, a regular patient at the pharmacy, arrives to pick up her refill medication for COPD. Jordan, the intern technician, greets Mrs. Alva, stating their role, and requests to confirm her address and date of birth before proceeding. After confirmation, Jordan collects the medication from the pickup drawer, at which point Mrs. Alva expresses frustration that her medication doesn't seem effective. Jordan asks Mrs. Alva if she would like to pick up the medication, and Mrs. Alva agrees. Jordan scans out the medication and is about to collect payment, not considering further actions. After being prompted to reflect on ethics and standards of practice, Jordan decides to suggest that Mrs. Alva consult her doctor. The assessor steps in at this point and asks the pharmacist on duty to speak with Mrs. Alva regarding her medication concern. It is determined that Mrs. Alva is improperly using her Spiriva hand inhaler by swallowing the capsules. The pharmacist shares this information with Jordan and will inform Mrs. Alva's physician, but asks Jordan to provide a device demonstration. Jordan then walks over to a computer to look up the device without informing Mrs. Alva. The assessor notices that Mrs. Alva looks confused and prompts Jordan to keep her informed. After a few minutes of Jordan reviewing the Spiriva hand inhaler product monograph, they call Mrs. Alva to the pickup counter and provide a device demonstration. The assessor notes that a private counseling room was not offered. The information provided by Jordan was disorganized, and a prompt was given to utilize a placebo by demonstration device. The assessor guides Jordan to also include information about storage and cleaning. Jordan can confirm Mrs. Alva's understanding with the teach-back method and then completes the sale of the prescription. Jordan then goes on to work on data verification, forgetting to document the interaction in the patient profile. The assessor guides Jordan to complete this step. The documentation is unclear, and the assessor then asks Jordan to review and edit the note for clarity and conciseness.
If you've not already done so, please pause this slide to give yourself some time to reflect on the details of the case and what rating, based on level of guidance, you would give Jordan. It is probably clear to you that, As was with the previous case we listened to, this case also demonstrates where a candidate requires significant level of guidance and would receive an unsatisfactory rating. The last duty for you as an assessor is to complete the final assessment of your candidate and submit it to the NSPR. Here are some key reminders for you. Consider the performance of the candidate over the entire assessment period, not just for one day, on the first day or the last day. Enter comments about your candidate's strengths and weaknesses and observed behaviors for every key competency. Select a rating for each key competency based on the performance you observed. Only assess based on observed performance, not the potential for a candidate to perform at a higher level. A reminder that there are no half ratings. Lastly, submit the final assessment via the NSCP's online form, which can be accessed from the website. The completed assessment is to be submitted within 3 business days of completion of the assessment. We have come to the end of the presentation. As a final reminder, the intent of the NSPR-PTA is to allow for a clear and objective candidate assessment. Valid assessment results hinge upon the fact that assessors understand the tool and are able to competently use it in a consistent way. If you have any questions, please feel free to reach out to registrations@nspharmacist.ca. Thank you once again for your interest in being an NSPR-PTA assessor.